Now that the post-prandial naps probably are over, we've had a lot of science and ophthalmology, something different, a different take to wake up everybody. At the outset, I would like to thank Dr. Professor Rohit Shetty sir, my mentor on and off the field, for this opportunity. And Narayan Nitrale, it's always a pleasure to be back here. So I'm going to be talking on, the AI through the patient's eye. I get a chance to become a patient now, put my doctor's hat aside and see that when a patient is coming to you, we can do all our research, we can do all our cases, but we'll only be able to do it once the patient comes to our clinic. So when a patient comes to our clinic, what does he research? What does he go through? What does the internet supply that patient? And then that patient walks into our clinic. It's time to flick the switch and see what the patient is thinking. So what do? I go to Google and I type exactly what the topic is: AI in refractive surgery. What it gives me, this is absolutely fine till here. It tells me that, AI will enhance precision, it will give safety, personalization, all good till here. Then it tells you about the future outlook and the benefits, improved accuracy, personalized care. Then you click that button that is there at the bottom. Dive deeper into AI mode. Once you click that, it gives you the key modern techniques. All that is absolutely fine again. Till you see that what is there at the bottom, what Professor Shetty was talking of in the morning. Illusion. If there's something that your brain starts seeing, that is the only thing that the brain will start seeing, everything else will become a blur. So the line at the bottom reads, goal is often super spectacular vision better than 20/20. Where did that super spectacular vision come from? Nobody knows. But the patient has picked that up. Everything else is all scientific. He's talking about wavefront, smile, contour vision, that's all scientific. The patient is going to concentrate on what the patient wants. That is super spectacular vision. So the expectation suddenly is now beyond 20/20. The patient wants beyond 20/20 from you. Why? Because the AI told it so. They say seeing is believing. But you don't have to see it to believe it. Believe it and you will see it. The patient is already believing that the patient post-operatively will have more than 20/20 vision. And it's to do with what us ophthalmologists have fed in on the internet, on social media. We have already fed it onto the internet, and that is where the AI has picked it up from and given it on a plate to the patient that you're going to get super spectacular vision post-refractive surgery. The other thing, whatever is new, whatever is latest is more expensive. And psychology says if it's expensive, it must be better. So the new thing, the new kid on the blocks, whatever the technology, we place it at a higher expense than the one that was previously there. So automatically in the patient's mind, it becomes that the new thing, the more expensive thing is the better thing. The latest technology is not always good for anything except to the producers of the technology, is what they say. Okay, Gen Z, what is this? A lot of you would know this. That's correct, Snapchat. Now, what is Snapchat doing in this talk? So, in 2018, Snapchat came up with a major update. Now, that update was highly criticized. They redesigned the app, and from a 5-star rating on the App Store, it got down to 1.9 stars, and over 1.2 million users signed a petition to change it back to what it was originally. So latest does not generally fit the bill always. It is not necessary that if there is an advancement in technology, it is going to be good in the real world. It might be good in the theoretical world. Social media, as we know now, is part of our IV line. We are there on it all the time. So how do social media algorithms work? So they factor in relevancy, they factor in recency, engagement, and post type. Once a patient starts seeing a reel, the algorithm picks up that the patient might be interested in getting a refractive surgery done, and it will be fed all the data of refractive surgery that has been put up by ophthalmologists in the area that the patient is scrolling in. So that is how that algorithm works. And then there is just data getting into the patient's mind. But again, as I say, science will be ignored, and whatever the patient wants to pick up in that illusion will be picked up by the patient. AI is powerful, but it's not a doctor. doctors aren't afraid of AI. They're afraid of being responsible for tools that they didn't design and can't control. As in the morning again, Dr. Shetty said, sometimes, with these new machines like the InnoEyes, he said, you need to trick the machine to actually be able to do what you want the machine to do. Otherwise, it will just not do it. Because in its data, it is not fed. So you need to trick that machine. So AI versus the doctor, that debate, who's better? The pros, of course, of AI are speedy diagnosis. It cuts paperwork. The cons, it misjudges cases and carry a bias. So we need to use AI as an agent and not as a replacement. It is an agent just to make us a better doctors, but not as a replacement. And we need to make it clear to the patients that it is not a replacement. The man behind the machine is still a human. It's still a doctor. Whenever a patient walks into your clinic, into your consultation room, there is only one alpha in that room, and that one alpha has to be you. If that alpha is the patient, you're already on the back foot. So maybe 25 years from now, this is what our clinics are going to look like. But mind you, in the patient's eye, after looking through the internet, they feel that this is how the clinic is today. Patient needs to get that reality check. Patient thinks this is how I'm going to be examined. There are going to be doctors all around with iPads and moving around and basically seeing things on just like Iron Man does, pick up a screen from there, throw it there. Patient does have that sort of mentality now, post seeing all these movies and seeing things on the social media. So till the time we actually get to this stage wherein we are able to scan the body in front of the patient and basically pick up points from wherever you want in the human body, till then we need to be the connect between the AI and the patient. As doctors, we need to connect that bridge. And once that bridge is connected, we know that expectation is not equal to reality, and when the reality is not met, when the patient has already got an expectation of super spectacular vision, which he read at AI, the emotion will be what the emotion is here. The idiot syndrome, we all know the internet-derived information obstructing treatment. With AI, it has gone to another level. So don't let that fog your vision, don't let that fog your judgment to be able to do the best for your patient. Thank you so much.
Thank you, Dr. Rohan.